We all started hearing about it in December, and that was back when it was pretty much in China. It started spreading, going to other countries, and ultimately made it to the United States.
The most important lesson I took from those conversations was prepare, prepare, prepare.
Preparation really was a bit fragmented at start. We were working in pockets with what are we going to do with the critical care side of the house, with PPE, with testing.
Well, there was a lot of unknown in March, and so we were trying to develop plans and understand how to react to a situation that we didn't have a lot of information about.
Last night, for example, I think 10 PUIs turned positive in the hospital. What we're looking for is, the incline on the curve. Because the experience in New York and Washington is when you see that, all of a sudden you're overwhelmed.
The first meetings really focused on the physical environment. One of the first things that we did is we went down to the emergency department and looked at the registration areas and did we have appropriate protections in place for the staff and for the patients when they came in.
I've been engulfed in preparation for the last 1 to 2 weeks. I think Friday is when it's just going to blow.
Starting Saturday, we are going to see a surge of possible COVID-19 positive patients who may or may not have COVID-19, but we're going to exponentially see a huge growth of patients.
Potentially, yes, as soon as that.
These are your suits.
There's already contamination everywhere. You said somebody's in there bagging the patient. I don't get it. What are we accomplishing with this?
The recommendation is to not bag the patient. The
So
recommendation is to not
but
bag
what
the
if they're
patient. To use
dying?
100% non-rebreather if we can.
Dealing with the new pandemic and new disease process, those guidelines, recommendations change constantly, and that was frustrating for us to have to continue to go back and update and change ours on a daily basis.
The bottom line is that none of the patients were in a, quote, danger zone with respect to too much heparin.
But after every single meeting, every time we made a change, we iterated our policies, procedures, and processes, and we memorialized that and we put those in the public data space.
Around that time, we started getting a little more organized, though, and realized this is a disaster, and we need to go ahead and implement our command center. So the command center is really a multidisciplinary group of individuals, including hospital leadership, clinical leadership from both the physician, nursing, and other standpoint, that meet on a regular basis, trying to problem solve, having everyone in the room together that can make these decisions.
In Surge 2, we still find ourselves taking care of patients whose lungs are really, really injured, really severe ARDS. We've learned how to learn, I think, in Surge 2.
Having the right team in place that you can count on, that you can delegate to, and that they have a team in place that they can delegate to is really important.
Some advancements in our knowledge of how to care for them that really, I think, ended up having better outcomes for our patients.
We have a lot of evidence-based therapies now in Surge 2. We have remdesivir, Decadron, we have anticoagulation, we have convalescent plasma, and there's a lot of things we know not to use.
I think that we learn to live in sort of this dual environment where we safely take care of patients who need care and services regardless of what their diagnosis is, but we also can safely and appropriately take care of patients with COVID-19.
Surge 1 back here in March and April. We thought that was tough, and then the second surge hit, and you can see where our peaks were and how we're declining right now.
We need a big breakthrough in taking care of these patients. Obviously, prevention's key, but a big breakthrough is really needed.
Universal masking and social distancing isn't going away for a long time, and so we need to continue to stress that, certainly in our hospital, but through our community.